Hello, everybody. Welcome and thank you for joining us today for our ASA webinar. My name is Julia Burrows. I am your host. I am a program coordinator with the American Society on Aging. We are so glad to have you join us today. Our presentation today is titled Mental Health and Aging, Supporting a Loved One, which is part of the Empowering Professionals in Aging series presented by Home Instead Incorporated, franchisor of the Home Instead Network. We will be getting started shortly, but before we do, we have a few housekeeping things to keep in mind. The slides for today's presentation are available under your tab on your screen labeled Resources. Under the tab labeled CE Application here, you will find information on how to obtain CEU credit for today's event. You have 60 days to complete the CEU application, and it may take up to 30 days for us to process that application and issue those CEUs for you. If you are not logged in directly to this webinar, that is if you're watching as part of a group and did not log in using an individualized confirmation URL, you will not be eligible for CEUs as we have no way of tracking your online attendance. So please make sure that you register using your own email address and use that individualized URL. If you have any questions during today's presentation, you can send those to us at any time using the questions box, and we will save the last 10 to 15 minutes of today's presentation to get to those questions. So our presenters today are Lakeland Hogan, Dr. Lakeland Hogan. She is a gerontologist and caregiver advocate at Home Instead. She educates professionals in aging, families, and communities on the unique challenges that older adults face and the resources available to help them thrive. Dr. Hogan has worked in the private and public sector for senior care services and has spoken at national and international conferences on caregiving and aging. She also serves as a resource to the media. She is a board member of the National Alliance for Caregiving, board chair for the Dreamweaver Foundation, and vice chair of the Alzheimer's Association's Dementia Care Provider Roundtable. With us today, we also have April Ibarra, a gerontologist and strategic partnership manager for Home Instead with more than 25 years of experience in healthcare and aging. She is passionate about improving the lives of older adults through advocating, educating, and providing resources to help them live their highest quality, most independent life. Thank you both for joining us today.
Thank you so much, Julia. Hi, everyone. We are glad that you have joined us for this very important topic, mental health and aging. Really, if untreated, mental health disorders can have negative impacts on social isolation, placement in long-term care facilities, or even suicide in relation to the aging population. Older adults who show signs of having a mental disorder are less likely than younger adults to receive mental health services. And when they do, they're less likely to receive care from a mental health specialist. So as professionals, we have a vital role in helping older adults, our clients, those that we serve, and their families recognize mental health disorders, the signs, the symptoms, and then support them in obtaining evaluation and appropriate treatment for mental health. So I'm glad to have my colleague, April Ibarra, joining me for this very important topic. Anything you want to add, April, before we really dive into the meat of our presentation when it comes to kicking off this topic?
Yeah, I just want to thank everyone, first of all, for being here. It's a difficult topic, but I think talking about mental health in this day and age is vital for each and every one of us. So while we'll be focusing on aging adults and some of the issues specific to them, we know that each of us could benefit from this information. So we're thrilled you're spending some time with us. Thank you.
April, you're so right. This topic is applicable to all of us, especially with all that we've been through COVID-19. I know that many of us have been under an immense amount of stress and strain, especially if you're serving older adults. You're working in long-term care. So your mental health is just important for those that you serve. But today we're really going to focus on mental health and aging. And so here are our objectives. I hope that we'll be able to better describe the prevalence and of mental and emotional health issues in older adults, understand the types that are most common in our later years, review how the pandemic, how COVID is impacting mental health and emotional health, and talk about some of the warning signs of mental distress and suicide. I know that's not always a topic we like to discuss or or it's still a little bit taboo to discuss, but it does happen in the aging population, and we need to talk about it. And then finally, we'll leave you with some tools and resources for supporting individuals and their family caregivers. And really, we need to be talking about why mental health is a public health issue. It's important to note mental health is part of our overall health. The World Health Organization defines health as a complete physical, mental, and social well-being, not just merely the absence of disease or infirmity. And so really, we need to be focusing on all aspects of health. You've probably heard the term, whole person evaluation, or focusing on holistic care. And I think we're really moving more so towards that when we talk about the care of everyone, especially the aging population. We need to consider aspects of our mental, physical, and social well-being because they don't exist in silos. They are interconnected. So we need to think of mental health as an essential part of our overall health, and it must be recognized and treated with the same urgency as physical health. When we think about mental health as a public health issue, we need to recognize that mental health has a huge impact on how people relate to others, how they make decisions, and how they manage and handle their stress. And a person's ability to live a fulfilling life often depends on their mental health. So this makes protecting and restoring mental health an important concern for public health. And really, when we look at the goals through the lens of public health, it should include, identifying risk factors. As professionals, we need to be able to know about the risk factors and be able to identify them in those that we work with, and also teach the families that we work with about these risk factors, these identifiers. Also increase awareness. I think during the pandemic, we really talked so much more about mental health. There's been a greater spotlight shown on mental health and the importance. And there is also this myth of, that depression and anxiety, it's a normal part of aging. That just happens to you when you get older, and that is not true. So again, increasing awareness, debunking those myths, and making sure people are aware, and then also increase awareness about the support. We also need to look at eliminating health disparities. We know that healthcare disparities exist in our healthcare system in general, especially among minority populations. So it's important that we look at this through the lens of equity of the services being provided. And also we need to improve the access to mental health services. That kind of goes hand in hand with the equity piece. We need to make sure that people have access to help and treatment. We want to make sure, especially in rural populations, we know that there is definitely a lack of providers for mental health. So we need to make sure that we can increase access. And again, I think the pandemic has really improved our telehealth capabilities, both in urban and rural settings. And so how can we lean into that more to make sure that people are getting the help that they need? And then removing that stigma. Again, COVID has kind of helped to peel back the layers of the onion on mental health, expose it a little bit as an issue we all need to be mindful of and aware of, but there's still a ways to go. And so if we look at the types of mental health disorders, these are the two that seem to be most prevalent in the aging population: depression and anxiety. And before we dive too much further into the meat of these types of mental health disorders, I think it's important to talk about the language. So just as there is a movement in the Alzheimer's and dementia space to use person-first, person-centered language, the same is true in the mental health space. So in Alzheimer's, we don't say Alzheimer's sufferer or Alzheimer's patient. We have changed our vernacular to say a person living with Alzheimer's, a person living with dementia. And so that is true of how we should be referencing individuals living with mental health. So no longer do we say mentally disabled, mentally handicapped, mentally ill, a person has a mental illness. We want to instead be person first. This person is living with bipolar disorder. This person has schizophrenia. They're not schizophrenic. So I think it's really important that we're mindful of how we refer to individuals that are living with mental health issues, because we don't want the disease or the disorder to define who they are. They are a person first, and they happen to have one of these types of disorders. So now that I've gotten off my soapbox a little bit on that, again, most of the older adults I have worked with in my career have been experiencing depression and anxiety. And again, while it's common among the older adult population, it is not a normal part of aging. I mean, it is normal for as we age to lose loved ones, to experience grief, to experience the normal ups and downs of life. But many experience depressive symptoms to a point that it does need addressing. It does need to be brought to the attention of a healthcare provider, of a mental health provider. So sometimes families assume, again, that you just get depressed as you get older. There's not much that can be done. So why bother bringing it up? But it's really important that we communicate to those that we work with that there are treatments available, both medications and in forms like counseling, psychotherapy, and so it is important to address. So when we look at major depressive disorder, again, it's common among older adults, but it's not a normal part of aging. So if we're educating, we want people to know of the cognitive and somatic symptoms. So they might be complaining of cognitive symptoms like issues with memory, executive functions deficit, difficult concentrating, kind of that foggy feeling. Maybe they can't think clearly. And then from a somatic symptom perspective, you might see some fatigue, a lack of energy, sleep disruptions, and other symptoms can also include a loss of interest in activities and a loss of interest in living. And so these, again, are something that should not be ignored. We need to bring these to the attention of their healthcare provider. And it is believed that there is a higher prevalence of dementia among the older adult population than is formally diagnosed. And again, this is likely due still to that stigma or belief that it's a normal part of aging. So while there are some statistics around how much of the population is impacted by depression when we look at the older age categories, but again, experts believe that that's a little bit lower. And there are treatments for depression. I mentioned medication, psychotherapy, and we'll talk about this a little bit later. If somebody has lifelong depression, depression that starts in their younger years, it might have a more complicated treatment plan than older adults who experience depression for the first time in later life. And then that second common type of disorder that we see in older adults is anxiety. It's less common actually among older adults than it is younger adults. So younger adults in today's day and age have a higher rate of anxiety than the older adult population, but it still is prevalent. About, if you look at various studies, anywhere from 3 to 14%, it's a pretty wide range there, of our population of our older adults have anxiety. So some of the hallmarks of anxiety, the cognitive symptoms, the ruminative thinking, the distractibility, the affective symptoms, worrying, being fearful, having a low mood or high irritability, and then somatic symptoms, racing heart, sweating, stomach issues, and then other signs of physical arousal. And I personally have struggled with anxiety for the past 10 years or so, and I can definitely identify with a lot of these symptoms. And I remember my first time when I had, it wasn't a full-fledged panic attack, I come to learn, but I was having those somatic symptoms. My heart was racing. I wasn't feeling good. I ended up in the ER because I was afraid of what was happening to my body, and learned that I was having these anxiety-related symptoms. And so I since sought treatment. And there are different types of anxiety, and there are treatments similar to treatments for depression. So there are medications, and there are psychotherapy interventions. And so the various types of anxiety, it could be a generalized anxiety disorder, panic disorder, which are frequent panic attacks, a specific phobia or fear of a particular object or situation, like a fear of heights, a fear of animals. Also, social anxiety disorder, being fearful of social interactions, or agoraphobia, fear of leaving the home. And sometimes we do see that in the aging population. And there are a few, so in addition to depression and anxiety, there are a few more types of mental health disorders that we do see, not as commonly though. So we do see probably out of this list, the top two are what we see a little more commonly. So sleep difficulties amongst older adults. About half of older adults at any given time express issues with their sleep. And so this is something to pay attention to because it could result in a greater risk of physical and mental health comorbidities, higher health service utilization, greater functional disability, reduced quality of life, and can even lead to mortality. And sleep disorders include various types of sleep disturbing patterns and various types and various causes for those disruptions. So again, don't just assume that as you get older, it's normal to have disrupted sleep. It's important to express those concerns to a healthcare provider because there are sleep hygiene routines that can be implemented to help foster more higher quality sleep. We also know cognitive impairment and neurological disorders happen amongst our older adult population, and this encompasses a broad range of disorders that include some degree of deterioration in cognitive functioning that alters their daily functioning. Again, it's not a normal part of aging and represents a change from the person's previous level of functioning. So really the areas of the brain that are affected really dictate, what kind of neurological disorder it is. And they vary in terms of severity and the onset, and they vary kind of in the disruption to the person's daily functioning, everyday functioning. So some examples of this would be Alzheimer's disease, Parkinson's, frontotemporal dementia, Lewy body dementia, those types of, again, neurological disorders. Another category of disorders that we see in the older adult population is obsessive compulsive and related disorders, and this would include hoarding disorder. I know I have walked into the homes of a good handful of older adults over the years and realized, okay, this individual does have a hoarding disorder. This is characterized by chronic difficulty parting with possessions regardless of their actual value. I like that definition. And over time, this relates to an accumulation of a large number of items. So again, they're having difficulty parting with possessions, and likely there is an underlying cause. Again, it's something that can be addressed, and so the severity can really vary, but we see usually the severity of hoarding increases with every decade of life. So if an older adult in their 60s have a little bit of a hoarding disorder pattern, then likely it's going to kind of increase in severity over time. Another is OCD, obsessive compulsive disorder. We also see bipolar disorder. This is pretty rare. It's in only 0.6% of the population, but the most common or most well-known form of bipolar is bipolar 1, categorized by manic depression. And for diagnosis, the person usually experiences a full-fledged manic episode, impaired judgment, reckless behaviors, that sort of thing. Substance-related disorders, this would be diagnosed in an individual who has a problematic use of a certain substance. And we see, a growing concern around opioid use in the older adult population. And so those disorders, of course, need to be addressed. We see post-traumatic stress disorder, and this occurs following exposure to a traumatic event. And, in the older adult population, we see this often in the veteran population, but we also see this in those that have a history of abuse or neglect. And sometimes, while they might not have signs of PTSD in their later years, sometimes the PTSD will manifest in older years based on the circumstances and the things that are happening in the individual's life. And then personality disorders. We see this again in a very small percentage of the older adults that we serve, but it is one that we might come across from time to time. And there are important considerations for mental health across the lifespan. Again, it's not a normal part of aging. And if you look at the older adult population, 26% of older adults 60 and older meet the criteria for a diagnosed mental health disorder, so 26%. And the age of onset varies by disorder. About 90% of those with a lifetime case of mental health disorders, it's usually diagnosed by age 42. So if somebody is having mental health issues earlier in life, I mentioned earlier, if it continues across their lifespan, sometimes their treatment can be a little more complicated, a little more complex. The rate of mental disorders vary by setting. We do see a higher rate in nursing home residents. And if you look back at the history of mental health in our country, there was a movement to deinstitutionalize mental health facilities. And so what that did is take individuals out of a facility setting and bring them back into the community and provide more community-based, home and community-based services in regards to mental health. And so what happened kind of as a result of that is nursing homes saw an increase in the individuals that they were serving with mental health issues. So again, that deinstitutionalization happened a few decades ago, but we're still seeing the impacts of that. When we consider mental health across the lifespan, we often see it in three patterns. The first being someone who developed a mental health disorder early in life and maintained this disorder into later life. Second would be those who grow older and then experience a mental disorder for the first time later in life. And then third, those who came into later life with a liability, whether that be a genetic influencer, a life stressor, maybe it's that trauma that I mentioned earlier, and then it was exacerbated by the conditions of later life, producing a mental health disorder. So there are various kind of patterns that we see commonly. One thing that, again, is important to keep in mind is this biopsychosocial model of mental health disorders. I talked earlier about how, we can't look at any of these things in a silo. Our mental, physical, social well-being, it's all interconnected. And so this model of mental health disorders looks at kind of the points of combination in three factors. So our biological factors, these are things like our genetics, medical disorders, medications, other psychoactive substances, nutrition, hormones, physical trauma. And then the psychological factors, these are things like learned behaviors, faulty or unhelpful ways of thinking, one's coping strategies, defense mechanisms, self-esteem, personality traits. And then third is social factors. And these are things like culture, race, socioeconomic status, relation and influence of one's environment. And again, these three factors, these three elements are interrelated. And it's important to understand the interactions between them when we consider mental health issues and we consider kind of diagnosis and treatment for older adults. And I want to just kind of talk through an example of how these factors could be interrelated. I'm kind of a conceptual thinker, so I like to use examples. So if we were to talk about, let's take Jean, for example. Jean struggles to make herself do her daily routine. She has arthritis that's making her activities of daily living more challenging. It's hard for her to admit that she could use some help, and she can't imagine having a professional in her home. She also longs to feel safe in the neighborhood around her. She moved in when she was, or decades ago when the neighborhood was thriving, and now the neighborhood has deteriorated and crime has increased. And she's frequently afraid that she could be in danger. And she imagines all sorts of scenarios, break-ins, robberies, vandalism. And when she has these thoughts, she starts to feel her heart speed up. She starts to feel faint. Her face and neck become kind of red, and she becomes hot and clammy. And recently, she stopped going out and about for fear of having a panic attack in public, and she just wants to keep herself safe. She wants to stay at home. So she's starting to rely more on her adult children to bring her groceries and supplies. She rarely, again, leaves the home anymore. And her kids are getting concerned. They're really seeing a change in their mom. And so it seems to me, and again, I'm not a mental health therapist, so I can't make a formal diagnosis, but in this situation, Jean seems to be suffering from some anxiety. She might be living with some anxiety due to the factors, again, amongst this kind of biopsychosocial model that we just went over. So some biological factors that we might want to kind of clue into and see if we can help provide some medical intervention, maybe in her arthritis. Maybe if we make sure she's getting good treatment for that, then she can do more things for herself. And then from a psychological perspective, she's having some of these unhelpful thoughts. And so perhaps some psychotherapy would be beneficial for her, ways to help her process her feelings, and then also the social factors, making her physical environment feel more safe. Perhaps it's installing an alarm system of sorts, or maybe talking through the benefits of having a professional come to the home, someone checking in on her regularly, someone that she can build a trusted relationship with. So again, if we only address one of those three factors, we're not really addressing Jean's whole person from the biopsychosocial model of mental health disorders. So again, it is important for us to address these issues in the older adults that we serve, and make sure that they get to their healthcare provider. And just some additional considerations for older adults and mental health. One challenge in diagnosing a mental health disorder among older adults might be distinguishing between mental health and cognitive related changes. Often, Alzheimer's disease, MCI, other major neurocognitive disorders have some of the similar symptoms as a mental health disorder. So that's why diagnosis is so important, so that we can address, is this a neurocognitive disorder? Is this, depression or anxiety? Also, another concern is comorbidities. Older adults often have multiple chronic conditions, and it's possible for them to also have more than one mental health disorder. So this can create some complexities in their treatment, and then often more healthcare providers get involved, so there's needing to be more communication amongst healthcare providers when it comes to maybe medications for treatment for their mental health disorder versus medications and treatment for their chronic conditions, arthritis, COPD, CHF, those types of things. It's also important to recognize that amongst the aging population, there are some common stressors that might contribute to the development of a mental health disorder, such as, issues or stresses over money, conflicts among family members, a decline in their own health and well-being. So those are some things that we need to be mindful of. Even retirement, going from having a lot of meaning and purpose, you get up and go to work every day, to kind of shifting into that retirement life, that could come with a transitional period. So we need to, again, just be mindful of these common stressors that could be contributing or impacting a person's mental health. Then it's also important that we don't shy away from the discussion around mental health and around the issue of suicide among older adults. It is worth noting that suicide rates are higher among older adults compared to the general population. And April's going to dive a little bit deeper on that topic in just a bit. But while it's important to identify a mental health disorder and encourage a person to seek treatment, but there are some barriers to mental health service utilization that are worth noting and being aware of. And so one would be access to mental health services in general. I mentioned earlier certain segments of the population, the rural communities, who might not have access to mental health services. There's also a shortage of geriatric mental health providers. I always say in another life, I would go back and become a geriatric psychiatrist. But I've already been through too much school to go do that again. But there is a shortage of mental health providers. And so we do need to be kind of bringing up the next generation of mental health providers that focus specifically on the geriatric population, because there are issues that are specific to older adults. And so having that expertise and training of a geriatric mental health provider is important. But I think regardless, having access to a mental health provider in general is still such a great benefit to older individuals. Also, funding sources. There, for some, is a lack of funding options to fund mental health services. I know that, again, through the pandemic, we've kind of shown a light on mental health. And even in last night's State of the Union address by our president, he talked about mental health and finding more ways to provide that service across our nation. So, and then also we need to be mindful of help-seeking attitudes. Some people, for example, have the mindset of, why would I go to psychotherapy? Because my problems are my problems and I'm going to deal with them myself. It's nobody else's business. So some people might have that kind of attitude towards or belief around things like therapy and treatment of mental health disorders. And some, again, believe that these symptoms are a normal part of aging, so they do not seek treatment. Some have kind of a misconception, their knowledge or fear of psychotherapy. And so we need to really educate people on the benefits and the experience. I think in today's world, going to therapy, going to counseling is more accepted, especially amongst the younger generations. But older generations, they might not be as open to it. There might still be that stigma. And then finally, transportation concerns. Some older adults might not be able to make it to an appointment to address their mental health issues. But again, the use of telehealth can be a great resource. I don't want to say alternative because we've seen great impacts of telehealth for mental health issues. So it is more available today than ever. And I've been talking a lot about COVID, so I thought I would bring up just some statistics that we have come to learn about mental health and COVID-19. We did see an increase in anxiety and depression among older adults, especially in the initial part of the pandemic, and that is an elevated level if you look back to 2018. So we did see a higher level of anxiety and depression in those living alone, in women, and in the Hispanic populations, in lower income individuals, and for those, if you look at that bottom line of that graph, for those that are in poor health, they experienced significantly higher rates of anxiety and depression. But I think what was interesting is that counter to what we may believe is in general about mental health, older adults as a group, they tend to be more resilient to anxiety and depression and stress-related mental health disorders during kind of crises or big world events such as a pandemic. They've lived through a lot. They have quite a bit of perspective compared to the younger generation. So some older adults, they may have developed kind of that resiliency and those kind of coping mechanisms for things such as this pandemic. And then AARP did a more recent survey last year on kind of a self-report on how older adults were impacted by the COVID pandemic. So some expressed sleep difficulties, again, more feelings of anxiousness, less interest or pleasure in doing things. It might be because they weren't able to do as much as they once were. More were feeling down, depressed, hopeless. There was an increased concern about the future. I thought that was interesting that kind of it's listed there at the top of that bottom half of the screen as kind of one of the biggest impacts is they're concerned about the future. They have more worry and stress, and I was interested. It was interesting to me that loneliness kind of trickled down to the second to the last category there, but it still definitely had prevalence. And if you look at the men's scores versus the women's scores, the women on the right, you can see there's an elevated level of concern in all of these areas for women. And COVID exacerbated some of the factors that impact mental health in older adults. And so the stress, those with mental health conditions had a significant impact on those individuals. The stress and the uncertainty created you know, a greater possibility that a person that already had mental health issues would experience those symptoms at a higher level. Also, those with physical health, pain, and disability during COVID, they tended to land in kind of that high risk, vulnerable category, and that for some compounded the stressors that they were feeling as part of this pandemic. Also, we know isolation, loneliness, being disconnected from others. I feel like I don't have to dive into the impacts of that because I feel like we as an industry, as professionals, we really know the impact that has had. Families or older adults often relied on families and support systems and services. And during the pandemic, for many, those were stopped temporarily or indefinitely. They weren't able to see family as often. And then, of course, losses. There's been 1 million people that have died in relation to COVID-19. And so older adults likely lost people in their lives, not on top of losing, their ability to go about their daily life, disruption to their routines. So definitely a great impact there. But I think it's important to recognize that during the pandemic, a lot of people stepped up to support their aging loved ones, those in their lives that were older. People were doing regular check-ins, video chats, finding unique ways for them to continue to do activities, even if they had to modify them, and help them seek, medical advice or care. Maybe it was through telehealth. Maybe it was driving them to appointments. I think people were checking in more regularly on their loved ones, bringing them a meal, helping them run errands. And so I hope that those kinds of things continue after the pandemic. I think it helped us create more of that community feel. But I think what's also neat is during the pandemic, people were able to seek advice from the older generations on how they've handled big world events in the past. And also there's just an expression of gratitude and appreciation for our older adult population through the pandemic. So I think there were some silver linings while it was challenging. I think there's just, again, a greater appreciation for how we can all make an impact on the older adults in our lives, and also, again, shone a light on mental health and the needs of individuals with mental health disorders. And so now I'm going to kick it over to April. She is going to take us through the rest of the presentation and talk a little bit more about depression and suicide amongst older adults.
Excellent. Thank you, Lakeland. And I tell you, my mind is just all over the place as I'm hearing you talk and I'm seeing the questions come in. And I think this is tough to wrap our heads around, right? As far as the reality, we know that it's not a normal part of aging to have depression and mental health issues, but we also see that there is a lot of loss in older adults. And quite frankly, it's clear that older Americans have the highest rate of suicide. Why is that? I don't mind talking about this very difficult topic because I actually lost my own parents to murder-suicide. And just saying that, I'm sure makes you uncomfortable because it's really tough to talk about. But the reality is, if there aren't those interventions, if we don't look at that biopsychosocial point of view, which I love that diagram and that concept, to really address all the risk factors, we're going to have an issue. And it's clear that this is the worst case scenario. So we've talked about depression, but research has consistently shown that loneliness and social isolation have a profound and negative effect on all aspects of health, including mental health. In fact, mortality risks of loneliness is compared to smoking 15 cigarettes a day. I'm sure you heard that. 50% of lonely people are more likely to die prematurely. And so we know that loneliness, I think, severely contributes to depression. I look at my own family. I look at the people I'm caregiving for now, and I recognize the losses that they've had and how it's gotten them to where they are now, in that depressed mode of thinking, what's next? Do I matter? How can I find a little bit of joy in my life? Um, Loneliness, and social isolation are rarely considered or addressed in health and mental health care settings, but we're getting better at it. But I think we really need to understand how important it is. And when people feel isolated and alone, and I think about everything that's going on in the world now, and many older adults, I'm sure you've been in your own family's homes, your own clients' homes, when you see people who just have the TV going all day long. Their perception of the world is what they're seeing on the screen. And so you can imagine that's difficult, right? So this is a challenge, and if we can just look at some of those risk factors and some different ways that we can intervene, we can maybe make a difference, right? And we know risk factors include living alone, loss of a spouse, having few friends, or caregiving for a spouse. I have family members going through every single bit of that right now, including poor health and that, the decreased mobility. I'm caregiving for an aunt, and she has talked more than once to me about her lack of will to live at times. And while that's tough to hear, you do have to address it, right? And everything for her changed when she stopped working and she stopped driving. Because I live an hour away from her. Her son lives close, but nobody's there. And she really feels like she doesn't matter. So it's tough. So those risk factors, which are things that we can, address and talk about and make some interventions, can make all the difference in the world. And I have to say, I share some anxiety similar to Lakeland. When I was 22 years old, I was divorced, going through college, and I started having panic attacks. And I would literally have what they called psychosomatic symptoms. I thought I was having a heart attack. I showed up in the emergency room, and the nurse looked at me and she said, "Honey, do you have some stress in your life?" And, pretty much for the next 2 years going through a difficult time, I was in and out of panic attacks. And I think we cope over time, right? Which is why when you're young, you develop perhaps some good skills, you get through your life, you find different ways. I tapped into yoga very quickly in my life as a tool. I also tapped into medications as appropriate, but I have better coping skills now. But as you can imagine, when somebody gets older, and they have not developed good coping skills, and they're dealing with depression, it's going to be tough, right? There are warning signs for suicide. And it's not a usual part of aging, as we said before, but clearly it is happening. People actually do talk of suicide. And I'm sure that you can think of situations where somebody has said to you something and you thought, oh, I don't want to hear this. I can't believe they're saying this. But in reality, they were talking about killing themselves or not being important or what does it matter or, those types of things. So they do talk about it. And their behavior, sometimes it is an indicator as well. Increase in substance abuse, reckless behaviors, the sleeping, the eating, giving things away. I have to, admit that my stepfather, before things happened with him and my mother, gave away all of his guns except for one. So it was very clear that things were going on, right? And that mood, that sadness, agitation, hopelessness, rage comes in all kinds of different shapes or forms. We cannot just treat the symptoms of the suicide risk like depression. We need to treat the suicidal thoughts just like any other condition. And I think healthcare professionals are realizing that now. Again, depression is a risk factor. Medical conditions, somebody has just been diagnosed with, a difficult disease or end of life disease. That loss of independence, how is that impacting? we always want to make it better, and I'm guilty of this. I'm a gerontologist as well, and I love aging adults and I want to help everyone. But we have to, understand that some of these things are deeply, deeply difficult for them. And while we think, well, you should be grateful to be alive, you've got another day, but when their function, their ability to live and do the things that they, even in a limited capacity, that they used to do, it's tough. It's really tough. And then that family discord, not everyone has, the type of family that likes, one another. So we have to, understand that there's a lot of things going on, with that older adult. And that term, you'd be better off without me, is clearly a warning sign. The American Foundation for Suicide Prevention, if you've not been to that website, has amazing resources. And they do have a guide on how to start and continue the conversation. And I just encourage everyone to understand that this is, it's not easy stuff. It's not easy things to talk about, but we also can't ignore it with our clients, with our families. Trust your gut. If you think someone is having a hard time, speak to them. Start with an expression of care, followed by an observation. I care about you, and I've noticed you haven't been yourself lately. You seem to be more frustrated than you have been in a while, and I'm wondering how you're doing. And just start that conversation. Don't ignore the warning signs. Having that honest conversation, you have to also realize or assume you might be the only person who's going to have this time and talk to them. So take advantage of it. If somebody gives you an opportunity to share their story, share their pain, take it and listen to their story. Don't try to make it better. Tell them that you care about them. Ask them directly. Are you thinking of committing suicide or hurting yourself? Encourage them to seek treatment, but avoid debating the value of life and minimizing their problem. That's the worst thing you can do, especially if you really, if you haven't gone through it, you can't say to somebody, "Oh my gosh, I know how you feel." That's not going to help them at all. Stay with them. If possible, remove any lethal means that they could hurt themselves. Encourage or call the suicide prevention line or take them to a mental facility or an ER. But don't ignore. We've talked about a lot of this already, and I think it's all great, encouraging all these things, but we have to remember sometimes it's not as easy as this. And the only fight I've ever had with my best friend was about mental health, and she just clearly did not believe that people should be depressed. They should buck it up and move on. And I was livid about that concept. You can't tell somebody who's going through somebody difficult, well, it's all going to be okay. Because sometimes it's not, but it could get better, right? So how do we stay with them and encourage them? But when people are alone consistently and feel like there's no one in their life, it's very likely that it's going to get worse. There's always good tips and things that we can do, and I like the idea of spreading calm, because if them talking about it makes you real anxious, they're going to be very unlikely to want to talk to you about it, right? And we know, again, as I mentioned before, with what we're seeing in the world today, it's enough to make everybody anxious. So creating those positive environments for yourself, encouraging, your aging adult or your clients, to do a few positive things. Again, going back to that biopsychosocial, we may not be able to solve the whole problem, but there are one or two things that we can tweak that might make life better. I think those are all things that, clearly at least will benefit the situation. And when you're caregiving for someone with mental health issues, well, that's tough too. My other aunt is caregiving for her spouse of 50, been married for 50 years. He was a difficult man during their early marriage, and he's a difficult man now with, dementia that has not been, diagnosed, and he's difficult. So you have to remember that you're going to be doing this for a very long time often, and when you live with them, it's very challenging. So you have to do the best that you can, but also recognize that this is a big stressor. I know when I talk to my aunt, every time that she always ends a conversation, she may rant for 20, 30 minutes, but she'll say, "But I'm fine. Everything's good here." And I believe her, but I still want to listen and support her because I know, even though she's handling it as best as she can, she is under tremendous stress. We can talk about the mental health for caregivers. It's difficult. All we can do is encourage them and help them to understand the impact of the stress on them, and to do the best that they can. And if nothing else, putting up barriers, even little ones. For example, my aunt won't let her husband smoke his cigar in the car with her because it's not good for her health. But she's not going to try to stop him from smoking cigars. But she put that barrier up, and you know what? He really has he's lived up to that barrier and is doing okay. So it's real easy to say, here's what you need to do. You got to take care of yourself. But when you're in the middle of it, it's tough. And as we are all dealing with our clients and our aging families and our own personal health, I hope this information is useful. I know we're running close on time, so I want to stop so we can go through some questions. So I think I'll stop there. And I love this quote. You do have to take care of yourself and keep your heart open to others.
And we'll leave this resource slide up. Thank you, April, for all of that
Yes.
wonderful information. We will leave this resource slide up as we go to questions, and you can download these slides. It is available to you. So we hope that you found this information helpful. It's such a robust topic. It's hard to condense it into to 1 hour's time, but we appreciate your time and attention, and we'll go ahead to the Q&A. So Julia, I will send it back to you.
Can you hear me now? Okay, very good. My mic
Yes,
dropped for a
Julia.
moment. Thank you so much for your information today. Like you said, it's so it can be such a hard topic to share with others, but it's so desperately needed. I think a lot of us in the aging services field have probably been touched by certainly the mental health challenges that we've probably faced with clients, and I'm sure myself included, we've all been touched by suicide. So I share everyone else's appreciation for both of you being here today and sharing your resources. So we have had multiple questions come in, and some of them are revolving around, is there a reason or is there a particular age when older adults are most vulnerable to develop or express a mental health concern?
Boy, that's a tough
question.
one. Yeah.
Well, I think what's so interesting, and April, I'll let you add to this, but everyone ages differently. I think that's why I was talking once with a fellow a geriatrician, and he said, I wanted to treat older adults and not babies because babies are all the same pretty much, and older adults are so much more complex. They have a rich history. So much has happened throughout their lives. And, you look at one person who's 80 years old, who's spry and very mobile and active. And then you can look at another 80-year-old who is very limited mobility, maybe severe cognitive impairment. So I think it really is so situational. I don't have a statistic on that particular question, but I think that some key things to tune into is if there's a big life transition, like a retirement, moving to a new city or to a new living environment, the loss of a loved one, maybe a diagnosis of a major health issue, those would be kind of the big times in a person's life that I would just be extra mindful of that person's mental health and make sure that they feel supported. And then if you're seeing those signs that we've been talking about through today's presentation, it's important to point them to their healthcare provider. But April, would you add anything else to that?
Yeah, I would say yeah.
I have a statistic in mind.
Yeah, I'm sorry. Go ahead.
No, I said there's not one statistic that
No. We're all such unique individuals, and quite frankly, I think it has to do with it's all those accumulated stressors that people have in life that quite frankly, sometimes it just gets to be too much. And what are their coping skills? Again, as we age, from these young people who've had to deal with this stress and that stress into parenthood and then to work, we all hopefully have developed some coping skills. If we haven't, it's going to be really, really tough as we age to deal with some of the things that are inevitable that other people can handle very well.
Great, thank you. And I like that kind of leads into our next question is, what are some things that we can do to help support individuals, to feel less isolated, and how to help we kind of intervene before we get too far along down the path?
Mm-hmm. Well, I'm a big fan. I'll jump in here because I think this is so important. It's just making time for them. Making time for the aging adults in your family. And I know if they're your clients, that's difficult. But people just want to be listened to. They want to be heard. They want to know that they matter. And, when we feel like we've become invisible, it's real hard to keep our hope and our spirits up. So call people, talk to them, pick them up for lunch, be patient.
April, yeah, I agree with that. And I would add, have a conversation. What social connections, what are meaningful to them, what gives them a sense of meaning and purpose? Have that conversation. Do they have any kind of goals that they want to work towards? You can still have kind of a bucket list or some goals you can work towards, well into your older years. And if those social connections are, going to a weekly Bible study or playing cards with friends, and maybe they can't get to those things because of mobility or transportation, try to help them to find ways to still engage in those activities. We both work at Home Instead, and one of the core services that we provide is companionship. So maybe it is, having regular family or friends. Maybe it's hiring a professional home care provider to come in regularly and provide that listening ear. Family may have heard the same story over and over again, but to a stranger or a professional, it's the first time for them. So interacting with new people can also be a way to just make them feel less alone, make them feel heard, as April said.
Absolutely. And we have a lot of more questions coming in, and I will go ahead and apologize that we will not be able to get to all of them. But I know that April and Lakeland have their emails available, and so if you would like to reach out to them, please feel comfortable doing that. I do have one last question, is would it be helpful potentially to share with a client or a loved one that you may have experienced some of these own issues, these own mental health concerns, much like both of you shared today about your own struggles and how you've overcome them and how you thrive despite some of those issues?
Yeah. Boy, I sure think so. As long as you're not making it up or pretending, I think if you're empathetic through your own experiences, I personally think that's okay. I guess it depends on your role.
Yeah, I would agree. I think that if in your particular profession, if it's not against any sort of health ethics or that sort of a thing, then sharing can sometimes open the door for them to share as well. And so, I think sharing personal struggles, it is something that I think many of us are touched by. And so knowing that you're not alone can be an important part of taking that next step to get help, because sometimes people feel alone in it, and they think, well, if I'm the only one going through it, then I'm not going to be the one to reach out for help. So I would agree that if it's appropriate to share, and it's genuine, then it could be helpful in that situation.
Wonderful. Thank you both again so much for your time today, and thank you to everyone that joined us near and far. We have reached the end of our hour, so we will be wrapping up now. Again, if you would like to claim CEUs for today's presentation, you will be receiving a follow-up email by the end of the business day. That will contain a link to the CEU application. That will also contain a link to today's slides. So that resources page, as well as Lakeland and April's emails, will be included in that. Again, you have 60 days to claim CEUs for today's webinar, and it may take us 30 days to issue them. Thank you, everyone, for joining us, and we hope to have you again soon. Take care.